this. And there are two major type of recovery of the mass of the body of the child. The first type, ideal type, the recovery of the mass at the birth is attained by the seventh, eighth day after the birth, and such type is revealed in 20-25% of newborn. And the second type is a delayed type. The recovery of the mass at birth is attained within 11-15 days, and such type is revealed in 75-80% of newborns. Then body mass increment within the first year of the life of the child. Uh, uh, you have to know that the average increment of the first month after the birth amounts to 600 grams. And then later, average monthly increment of the mass constitutes 800 grams for the first half year of postnatal life and 400 grams for the second half year of the postnatal life. So we can use the following formula for calculation the mass of the body of the child for the first half year. The formula present on this picture. You can see it. So the body mass equals the body mass at birth plus 800 multiplied by n, where n age in months. And body mass for the second half year equals body mass at birth plus 800 multiplied by 6 plus 400 multiply n minus 6, also where n age in months. And as a rule, at the age of 1 year, the mass of the body attains 10 kilograms through about 3 false annual increment. And later, the average annual mass increment amounts 3.5 kilograms for the second year of the life and about 2 kilograms starting from the third year. So we can use the following formula for calculation the body mass from the 1 to 10 years, 10 plus 2 multiplied by n. 10 the body mass at the age of 1 year, and 2 annual mass increment, and n age in years. But this formula holds true up to the age of 10 years. And body mass over 10 years of the children. So the average body mass at the age of 10 years is 30 kilograms, and later at the age of 10 years, the annual mass increment makes up 4 kilograms, and formula for mass estimation should be following 30 plus 4 multiply n minus 10, where 30 is the body mass at the age of 10 years, 4 annual mass increment, and n age in years. Several words about length of the body. The length of the body at birth, as a rule, in the babies born in due term, is 52 centimeters, and average length increment within the first year of life is 25-27 centimeters. The length doubles by the fourth year and triples by the age of 11-14, and body length at the age of 4 years is taken to 100 centimeters. The annual length increment at the age below 4 years is 8 centimeters, and annual length increment at the age over 4 years is 6 centimeters. So we can have following formula for calculation the length of the babies, of the children. 100 centimeters minus 8 multiply 4 minus n at the age below 4 years. And over 4 years, we use following formula: 100 centimeters plus 6 multiply n minus 4, where 6 annual length increment and age n age in years. Several words about the body mass and the length increment in the prematurely born babies. You have to know that the rate of physical development for the prematurely born babies exceeds for the babies born in due term. And at the end of the first year, the body mass for the prematurely born babies, if the body mass was at birth 1,500 2,000 grams, attain 10.5 centimeters. But mass increment ratio for prematurely born babies is 4-6 folds, comparing with 3 folds for the babies born in due term. If the body mass at birth was inferior to 1,000 gram, the body mass increment ratio attained 8-10 folds. The length increment in prematurely born babies. The annual length increment in prematurely born babies within the first year of the life amounts 26 38 centimeters, with a monthly increment of 3.3 centimeters in the first half year and 2 centimeters in the second half year of the life. On this picture you can see the proportions of the body. The first figure is a baby, young baby, and the last to the right is a adult. So you can compare the baby proportions of the body of the baby and of the adult. So the child, as a rule, has relatively shorter legs, a relatively longer trunk, and relatively bigger head as compared, respectively, with those in adults. And as far as child grows, the proportions of the body shift, and we can see that the relative size of the head decreases while the relative size of the limbs increases. And on this picture you can see also the proportions of the body. The figure on the left is newborn baby, and the last figure to the right is adult. So you can see the difference between them and between the proportions of the body. And the next parameter, the ratio of swinging of the arms to the body length of the child, and this ratio is constant. This ratio does not depend on the sex of the child, equaling 1:1, whichever the age. The next parameter of the physical development is the circumference of the head. You have to know the circumference of the head is 34-33 centimeters on average at birth. And after the birth, the circumference of the head intensively increases within the first months and years of the life. And for estimating the circumference of the head in the infants, the value 43 centimeters is taken as the reference one for the child aged 6 months. And for each extra month, the value 0.5 centimeters is added to 43 centimeters after 6 months. And for each missing month at the age less than 6 months, the value 1.5 centimeters is subtracted from 43 centimeters. And within the first 3 months, the monthly increment we can calculate using another calculation. Monthly increment of circumference of the head is about 2 centimeters. At the age of 6 months, about 1 centimeters, and within the second half year, about 0.5 centimeters. So, at the age of 1 year, the circumference of the head is nearby 47 centimeters on average, and at the age of 5 years, nearby 50 centimeters. So we can calculate the circumference of the head from the 1 to 5 years and using the following formula. 50 minus 1 centimeters. This is a minimal annual increment value of the circumference of the head, multiplied by 5 minus n, where 5 years the years of the child, and the age of the child, and 50 is the circumference of the head at the age of 5 years. After 5 years, the following formula is effective: 50 plus 0.6 multiply n minus 5, where 0.6 centimeters mean increment value this, of the circumference of the head. Then the next parameter is circumference of the thorax. And you have to know that the circumference of the thorax at birth is 2 centimeters less the circumference of the head. And it comprises 32-34 centimeters on the average. And at the age of 4 months, the values of the circumference of the thorax and circumference of the head are similar. Circumference of the thorax at the age of 6 months is taken as 45 centimeters. So we can calculate the circumference of the thorax within the first year of life of the babies. And for each missing month at the age less than 6 months, the value 2 centimeters is subtracted from 45 centimeters, and for each extra month, the value of 0.5 centimeters is added to 45 centimeters. For the children at the age from 1 to 10 years, we can use the following formula. You can see it on this slide. For calculation the circumference of the thorax, 46 centimeters minus 1.5 centimeters, the mean annual increment value of the circumference of the thorax, multiplied by 10 minus n, where 63 centimeters mean circumference of the thorax at the age of 10 years and n age in years. And for the children over 10 years, the formula can be modified as 63 centimeters plus 3 multiply n minus 10, where 3 annual mass increment or mass increment value of the circumference of the thorax, 63 centimeters mean circumference of the thorax at the age of 10 years. So Circumference of the thorax at the end of first year of life on average is 48 centimeters. uh, at the age of 5 years, 55 centimeters, and at the age of 10 years, 63 centimeters. You have to know that physical development has several valves of growth of the child, and the rate of the whole set of parameters of the physical development is maximal within the first age of life. Later, there are two periods speeding up growth. The first period is extending the length of the body falls at the age of 8 years, and the second period at the age of 11, 15, 16 years. Also, we can see the periods of rounding in shape when we can see the transverse increase of the transverse dimensions and growth of the muscular bulk, and this period falls this periods falls to the age of 1 to 4 years and from 8 to 10 years. Um, for assessment the physical development of the child, as a rule, we use several techniques. From them, the most important are somatometry, somatoscopy, and physiometry. Somatometric parameters comprise the body length, the body mass, the circumference of the thorax, the circumference of the head, the height of the body in sitting position, and length of the limbs. Somatoscopic features comprise the shape of the thorax, the shape of legs and feet, the posture of the child, relief and elasticity of the muscles of the child, the amounts of the fat, elasticity of the skin, the color of the mucous membranes, and six relative characters. And physiometric parameters, the vital capacity of the lungs, the strength of the hands muscles, the functional assay characterize the state of the cardiovascular system and motor development. And for assessment the physical development, we use pediatrics, used as two techniques. The technique of the approximate estimates in the base on the empirical formula given above, and the technique of anthropometric standards where the individual anthropometric valves are compared with age, sex, region-related anthropometric tables of standards, and non-parametrical tables presented as percentile values are used in clinical pediatric. And there are 5 grades of physical development. The first, average value, when the deviation of the actual data or individual parameters from the predictable one are within the following limits: x plus minus 7% according to empirical formula, or the next, the values of length and the mass falls into medial percentile range from 25th 75th percentile. The next grade or the second grade values above or below the average, when the deviation of individual parameters are within the following limits: x plus minus uh, 8 from 8 to 20% according to empirical formula, or a percentile range correspond to 75th, 90th percentile, or 25th, 10 percentile respectively. The next grade, the low or high values, when the deviation of actual data from the percentiles are within the following limits: x plus minus more than 20% according to empirical formula given above, and percentile range correspond to 10, 3rd percentile, or 97th percentile respectively. You have to know that physical development can be harmonious or disharmonious. And the harmonious physical development may be defined when the indices of the length of the body, mass of the body, and other parameters do not differ from the average ones, with the mass of the body and circumference of the thorax consistent with the length of the body. And disharmonious physical development must be defined when the mass of the body and the circumference of the body do not consistent with the length of the body. The main disorders of children's or child's physical development are hypertrophy, hypertrophy or dystrophy, obesity, and disorders of the length of the body, of height of the body, is nanism or dwarfism, small stature, and gigantism. And on this picture, you can see the child child with dwarfism and nanism, when body height is less than a limit of the 3rd percentile. And the causes of this disease is associated with various different diseases. It can be malnutrition and deficiency of protein consumption, diseases of bones, endocrine pathology, malabsorption as a result of enzyme pathology, chronic diseases of different organs and systems of the body, hereditary diseases, and chronic intake of different chemical substances, toxic substances. And also you can see example of dwarfism and nanism, disproportionate dwarfism and proportionate dwarfism. Disproportions caused as a rule as a disease of the bones, and proportion dwarfism as a lack of somatotropic hormone. And also example of nanism in adults. And gigantism, when the body height is more than a limit of the 97th percentile. And the first figure you can see with gigantism, the normal growth, and the boy with dwarfism. And also gigantism can be associated with several pathology. It can be result of the produce excessive somatotropin hormone. Then it can develop also in the setting of hyperfunction of gonads, anarchism, hyperarchism, and gigantism also may develop in patients with Marfan syndrome and others. And on this picture, you can see the man with gigantism. And several words about dystrophy. There are two types of dystrophy. The first, hypotrophy, according to extent of deficit, three grades of hypertrophy is evident: 1, 2, 3. And the term is used only referring to the children of the first half year of the life, and excessive intake of food. Also can be paratrophy. Also for the children of the first half year, we use only for the children of the first half year of their life. This is a child with hypertrophy and adiposity, the dystrophy associated with overnutrition, which result in excessive mass of the body, and 4 grades of hypertrophy are delineated. And on this picture, you can see the boy or girl with paratrophy, and the next boy also with adiposity, and the boy in pubertal period with also with adiposity. I would like to ask you, maybe you have questions. I'd like to answer for them, and thank you for your attention.
Thank you, Doctor.
What
About the lecture, we didn't for writing the notes. We didn't write all the notes. Some of them we skipped it. Where we can find the lecture as PDF?
you would like to have this lecture?
Yes.
You see, it's
Yes,
will be.
if you send us, it will be so helpful for us for review and study of the lecture.
So fast and we can't rewrite everything at the time.
We will send you this lecture because it's very important, because I tell you a lot of formulas and you have to know them, and it seemed to me it's no problem to send.
Yes, Doctor. Where you will?
When no, our you see, I have the helper which will send it to you. My assistant will send it to you.
So you will send it to the monitors?
No, we will speak about this.
Doctor, I have one question. Can I ask you?
Yes.
Doctor, I'm the monitor of group 6. How can I connect to my teacher, our teacher? Because so far we didn't have any practical class in the pediatrics.
I do not know what's the name of your teacher. My assistant will tell you. If you will have the group number 6, my assistant will tell you what is the name of your teacher.
Okay, then, Doctor, thank you. So could you give me her or his number, phone number?
Her telephone number?
Yes, Doctor.
Not I, my assistant.
I understand, Doctor. I
see,
mean the telephone
my
of your
assistant.
assistant.
Listen now, your question, and she will send you what you want. Understand?
I need her phone number for connecting about the time and kind of class.
She will send you the telephone number of your teacher.
Okay, thank you so much.
Goodbye.
Goodbye, Doctor. Thank
Is
you.
it all?
Goodbye, Doctor.
Yes.
Is it all? Thank you very much for your attention.
Goodbye.
Doctor,
Goodbye.
other students?